introduction, donc je n'ai pas de conflit d'intérêt, pas de parti pris politique, et donc je m'exprime en mon nom et en tant que médecin. Donc quand on parle d'éthique médicale, cela appelle à l'esprit critique, au débat, à la réflexion.
So just quickly, introduction, talking about this topic, no conflict of interest, no political affiliation, talking about ethics, and I'm going to talk to you through critical thinking just for a few quick minutes. The aim for us is to really bring the debate around this notion of ethical thinking. A few quick definitions: morals, ethics, and I would like to talk to you a bit about conspiracy and conspiracy theorists, which has been a term bandied around quite a bit for some time. And we'll like to say that, is this a reason to actually violate some fundamental rights? So we're talking about morals, it's about mores. That's what it comes from in Greek. It's determining whether something is, whether it's good or bad, but it's not within law. So there are little differences. Morals, it's usually for personal beliefs, convictions, which comes from our own past tradition and culture. Whereas ethics are used more as a way of removing oneself from their own beliefs and focusing on something more general and widespread. Obviously, you can't fully remove yourself from your own culture, your background, your beliefs. So therefore, to sum it up, ethics, it's thinking about one's own moral values. Unlike regular morals, medical ethics is a little different. It's about taking this thought about morals and coming up with a medical decision afterwards. So it's a little different. Now, pre-COVID, ethics was still very much trendy, and it was used in all branches of society. Now, you may have the best intents, but your motivation will depend on who you are and what job you do. A scientist is motivated by this desire to seek the truth and not to lay down their own beliefs. For a doctor, their ultimate objective is to heal and treat the sick. A doctor is not one to obey. They're there simply to take care of patients. And obedience, if you obey an order, it's just that you are carrying out what other people are telling you to do without even thinking. And that is the exact antithesis of what a doctor should do, or what a scientist should do. And so what we see is that there are so many conflicts of interest in this world. So therefore, it raises a number of questions. Is it legitimate or even ethical to lie if you wish to defend your own ideas? And Professor Delfraissy, who is a member of the scientific board, said just a few months ago that the health pass had a major impact in pushing people to vaccinate. But is the pass actually protecting people? No. So when you're in such a position of responsibility, how can you actually lie to defend your own ideas like that? And also, just recently, head of BFMTB said that they will toe the line if they have to. So therefore, ethical thinking is about a way of using ethics to lead you to make a decision. For that, you have thought models, thought schematics, which will help you come up to your conclusion. In some instances, you use mathematics, statistics to help you predict, but then also you have to use knowledge that you have, which will help you think. And what's important about knowledge is that it really helps you dig deep in building up your overall thought process. And as part of knowledge, you have scientific knowledge. Obviously, you have to take into account any form of cognitive bias that you may have. But all of this is what produces science. This is scientific debate. It's not journalists. Journalists don't decide what science is and isn't. And then around that, you have on one side, heavy industry, laboratories, because they carry out studies, surveys. You also have careers which have an influence over that thought. And there's also policy and politicians which have an impact over that scientific thought. And also on top of that, you have other impacts. You have public opinion, culture, religion, media, and the like. But all of this is what makes us human as complex beings. So people are part and parcel of ethical thought and governed by its own motivations, its own interests. And therefore, once you have that, that creates conflict of interest. One of the main limits is when it comes to binary logic. And our brain can't really handle breaking things down into more than just A and B. When we try and pull things down into A, B, C, and D, it gets complicated. And our B is cultural. We're taught from a very young age that we are taught of this binary world. We're taught from a child, it's good or it's bad. It's a good drawing. You've done a drawing, that's lovely, but why is it good to do that drawing? The problem with binary thought is that it goes against everything that a scientist should be, because humans and ethics are much more complex than just a binary choice. Let's take an example. Vaccination. Is it ethical to not want to be vaccinated? Well, if we use ethical thinking, we say this is the knowledge. We know that currently available treatments, vaccines, are effective to 95% of the time. They're effective in reducing how contagious you become, and there are no secondary effects. So therefore, it's moral to vaccinate. But what if the knowledge says it's low efficiency, that it varies from one person to the next, that there's a risk-benefit ratio, which is probably negative, that it isn't effective against whether the whether the virus is transmissible or not, and there are also some serious secondary side effects. In that case, then it wouldn't be moral to vaccinate. And one of the fundamental parts of scientific thinking is this scientific model and scientific debate. In this current crisis, we flipped it on its head. We started from the position that vaccines were not a treatment like others, and it was not up for discussion. It's obviously good. Sure, but what if there are side effects? You think there are side effects? Or if you think there are side effects, you're an anti-vax. Or if you think that it's not effective, then you're a conspiracy theorist. And that put an end to all scientific debate. So while the decision-making process is still binary, vaccinate or not, the thinking that gets you there is not binary. So now it's just people say when they want to think whether they vaccinate, well, you need to look at the efficiency, or what time, what age, what are the side effects, what immunities do they already have? And the main pitfall here is to have this notion of collective medicine, whereas we forgot the heart of what medicine is meant to be. It's about individual medicine and how complex each individual person is. That was lost sight of. Another major pitfall of this binary vision is that it's an all or nothing type situation, in that you can no longer account for errors or difference of opinion and judgment, and you are right. And sure, you may think you're right, but what if you're actually wrong? And you are enforcing your ideas on others, then everyone's going to be wrong. And that is what we call a health scandal, a health crisis. Now, just quickly about conspiracy theorists, because this is something we've been seen bandied about over the past 2 years just to put an end to any scientific debate. A conspiracy theorist is when someone states that another person or group of persons is premeditating action against other persons or person with this voluntary will to harm. And that's important, that will to harm. Let's talk about neonicotinoids. So you know it's a neurotoxin and that it causes cancer. And in 2016, they were banned. Well, the ban came in 2016, actually in effect in 2018. But neonicotinoids, they were brought back in during COVID, and no one spoke about it, really, because the risk-benefit equation was deemed to be favorable. Well, while it may be favorable, there are other side effects that may still be harmful, and we had to look at the both. Let's just say that there are more risks than there are benefits. If that's the case, there are two options. Either you reintroduce them simply because political economic stakes are more superior to health issues that are at stake. Or you may determine that it's because there's a willingness to harm. If that's the case, either this is true in case that's a conspiracy, or it's unfounded. So it's unfounded and it's a conspiracy theory, otherwise it's founded, and you know the government is actually acting against you. However, this top level, it's not a conspiracy, it is scientific debate. A conspiracy theorist is where you state something without proof. When you say that a group of or an individual person is acting with the will to harm, but you say it without proof. So let's think about ethical thinking. Currently, with the arguments that we now have, looking back, was it ethically acceptable to take the decisions that were taken back in 2020 and 2021? But remember, if we go back in the time, was it ethically acceptable to make those decisions? So these are different 2 points of view. So therefore, given the health crisis, can we violate fundamental rights? The right to move about, the right to work, the right to one's own body, the right for free consent, informed consent, the right for expression, the right to be a conscientious objector. These were rights that were violated. Can you force someone to be part of a clinical trial? Now, obviously, here I'm talking about vaccines that are currently going through phase 3 of testing. They aren't legal because we aren't following regular protocol. There's nothing standardized. We don't know how they're made, how they're mixed. And there's no free consent. There's no informed consent here. Can you lock up people who aren't sick for their own good? But this is exactly what was done for the elderly in retirement homes. Most of them were kept completely isolated for nearly 2 years. You know, if you're 90 years old, you should have a choice. And remember, this triage that was carried out on a societal level between those people who were deemed essential and those who weren't. The widespread long-term use of face masks. Again, you don't need to be binary in this, not just are they good or bad. But there's a difference between a surgical mask when you're in a high infection environment, or when you're a child just wearing a material fabric mask in the playground, or then when you've got politicians saying, I will survive out at a charity match drinking glasses of champagne. Can you force someone, knowing that there are deadly secondary side effects, Can you force someone to take a vaccine if it's going to expose them to these sorts of side effects? What about those non-vaccinated health workers who were tested negative? Can you stop them from going to work? Well, that happened. There were people who were unvaccinated but still tested negative who weren't allowed to work, but those people who were vaccinated still tested positive, they were, or who were symptomatic, they were allowed to work.
There are many other ethical questions that we can raise, and I won't have time to go through them all, but as a way of conclusion, unfortunately, now is no longer the time to make decisions. Now is the time to take stock of the situation and to wonder whether we actually made ethical decisions. I think that we confused illness with health. To me, none of the societal measures that we took actually had an impact on the evolution of the disease. And maybe even worse, I think that we realized for the first time that political health measures had secondary effects, adverse effects that were even worse than the disease in itself. So that's something that we need to ponder about. Thank you very much for your attention, and thank you to everyone who took part to the organization of this conference, and I do hope that we'll see more in the future. Thank you.